Hi everyone, so in this video I just want to talk about 4 different types of therapy. I'm not going to go into lots of depth, but I'm just going to give you a brief overview. So the first type of therapy is called psychodynamic therapy, and all that means is that you are looking back to someone's childhood and their past to reflect on the things that have happened in their childhood have then impacted and influenced their behavior as an adult. It goes a bit deeper than that, but it is basically anything that is psychodynamic means that it is going back and looking at the psyche of like the person now, but based on their childhood. So the next one is person-centered counselling. It's also referred to as client-centered. That is where you are working purely with the client and what they bring. The philosophy behind it is that a client or a person understands themselves more than a therapist does. So if you provide the core conditions of unconditional positive regard, non-judgmental attitude and congruence, then what will happen is that you will be in a therapeutic relationship where the person feels that they can speak openly, where trust is built. It's all centered on the therapeutic relationship between the individual, and there is not a lot of intervention in terms of asking questions. It's not very directive. It's mostly client-led. The third one is CBT. Lots of people have heard of it. It stands for Cognitive Behavioural Therapy. And all it really means is that the counsellor who's using this technique is looking at the link between what you think and what you feel, and then that impacts on your behaviour. So they're looking at the situation itself and how you respond to it. So they're trying to help people to understand that it's not the situation that is causing the behaviour, it's how you think and feel about it. So if you change your thoughts and your feelings then and respond to the situation, then your behaviour will be different. And the final one is solution-focused brief therapy. So this is used a lot for employee assistance programs. I work for one, and they use solution-focused therapy. It just means that it is short-term therapy, so it's usually 6 sessions. It might be a maximum of 8 sessions. It's solution-focused because you have the problem and you are working towards a goal. It's very direct, very structured. It's all about what is your problem. We can work towards it by you setting a goal, and the counsellor will work with you on that goal to achieve it. It also has lots of things like the miracle question. You know, if you woke up tomorrow and your problem was fixed, what would be different? How would you be behaving? So it helps the client to identify that there are solutions. It helps the client to identify what the actual problem is, to sort of narrow that down, and it helps to work towards solutions. So it's very much focused in a very directive way. So that's just a brief overview. I may do some shorter clips looking at each of these individually, but that was just to give you an idea. Thanks for watching. Bye.